All right, today we're pulling back that lead apron to look at one of the most common procedures in all of dentistry, the X-ray. We're going to explore the incredible science and, really, the skill it takes to get that perfect little picture of your teeth.
I mean, you know the drill, right? They put that heavy vest on you, you've got that sharp-edged piece of plastic digging into your mouth, and someone's telling you to bite down and hold perfectly still. It all feels so clumsy, but believe me, there's a fascinating reason for all of it.
So, here's our game plan. We'll start with why X-rays are so vital in the first place. Then we'll get into the big geometry problem of imaging a curved jaw. After that, we'll compare the two main techniques for getting the perfect shot, see what happens when things go wrong, and finally, wrap up with why all of this really matters for your health. Okay, so first things first, why do we even need them? Well, dental radiographs, or X-rays, are an absolutely essential tool. They let dentists see all the stuff the naked eye just can't, like tiny cavities starting between your teeth, bone loss from gum disease, or problems brewing down at the root. Without them, your dentist is kind of flying blind. So, what's the big challenge here? Honestly, it all comes down to geometry. Think about it. Your jaw and your teeth are these three-dimensional curved objects, but that little sensor they stick in your mouth, it's a flat, two-dimensional rectangle. The entire goal is to project that 3D reality onto a 2D surface without messing it up, without distorting it. So how does the picture even get made? It's through a process called attenuation. The easiest way to think about it is like a shadow. As the X-ray beam passes through your mouth, really dense things like your tooth enamel and bone, they absorb or attenuate more of those rays. Softer stuff, like the pulp inside the tooth, lets more of the rays pass right through. And that difference is what creates the black, white, and gray picture your dentist sees. So the bottom line, the whole point of this entire procedure is to get one thing: a diagnostically accurate image. We need a picture that is a true, faithful representation of your teeth, not one that's stretched out or squished or warped in any way. And that is where technique is everything. So how do you get that perfect image? Well, the number one method, the absolute gold standard for quality, is something called the paralleling technique. And this is where that clunky, awkward holder comes into play. See, to get the sensor perfectly parallel to your tooth, you can't just rest it against the curve of your mouth. That holder actually positions it a bit further away, which then allows the X-ray tube to be aimed at a perfect 90-degree angle to both the tooth and the sensor. It is pure precision geometry in action. And all that hassle is totally worth it for two huge reasons. First, this technique gives you an image with almost zero distortion. The length of the tooth you see on the image is its true length. And second, it creates a highly reproducible image. That means the X-ray they take this year can be accurately compared to the one from 2 years ago to see if anything has changed. That's critical. But what happens when the gold standard just isn't an option? Sometimes a person's anatomy, maybe a shallow palate or a really strong gag reflex, just makes using that bulky holder impossible. That's when they have to switch to Plan B, the bisecting angle technique. Now, this technique is a really clever compromise. The sensor is placed as close to the tooth as you can comfortably get it, which means it's now sitting at an angle. Then, the operator has to imagine a line that splits that angle perfectly in half. The X-ray beam is then aimed perpendicular, not at the tooth or the sensor, but at that imaginary line. It's basically a math trick to compensate for not being able to get things parallel. So how do the two stack up? Well, the paralleling technique gives you that top-tier accuracy and reproducibility every time. The bisecting angle technique is the essential backup for tricky situations, but because it relies on the operator's skill in visualizing all those angles, there's a much higher chance of distortion, like making the tooth look way too short or way too long. And this brings us to a really critical point. What happens when the technique, whether it's paralleling or bisecting, isn't done just right? Well, the consequences show up immediately in the final image. Let's look at a few common mistakes. If an image comes out way too dark, it's probably overexposed. If it's blurry, well, that means either you or the X-ray tube moved during the shot. And if the image is distorted, stretched, or squished, that's often because the sensor got bent or, you guessed it, the X-ray beam was aimed at the wrong angle. Every one of these faults points directly back to a little breakdown in technique. And listen, these aren't just ugly pictures we're talking about. A blurry or distorted X-ray can completely hide a cavity or make bone loss look way less severe than it actually is. That can lead to a misdiagnosis or the wrong treatment plan. It's why getting that perfect shot on the very first try is so important. So let's bring this all home. Why should all of this complicated geometry and technical stuff matter to you as the patient in the chair?
Well, it really boils down to two simple things: clarity and care.
You see, every single exposure to radiation carries some level of risk, even if it's small. So the guiding principle in all medical imaging is something called ALARA, and that stands for as low as diagnostically acceptable. And good technique is a huge part of that. Getting a clear, perfect image on the first try means no retakes, which directly cuts down on your total radiation exposure.
And get this, proper technique isn't just about how the x-rays are taken, but also when. A major study found that when dentists follow evidence-based guidelines on when to take x-rays, they end up ordering 43% fewer images. That's a massive reduction in radiation for patients, and it turns out they only missed a tiny fraction of cavities.
So, at the end of the day, good intraoral X-ray technique is all about getting the most diagnostic bang for the buck while minimizing any risk. It makes sure your dentist gets the absolute sharpest, most accurate picture possible to protect your health, all while keeping your radiation dose as low as it can possibly be.
So next time you're in that chair and you feel that awkward sensor in your mouth, you'll know exactly what's going on, all the precise alignment it's trying to achieve. You'll know that the simple request to hold still is about preventing a tiny blur that could hide a big problem. You're in on the hidden science of the perfect shot now. Kind of makes you wonder, right? What other simple medical procedures are packed with this much hidden complexity?